As a reminder, going forward, the weekly briefing will be every Thursday at 1 o'clock instead of Wednesday. And as always, for more frequent updates, I would strongly recommend that you sign up for our email list. It's a daily email, governor.ri.gov. So we'll begin today, as we always do, with the data, and I'd ask that you please put it up on the screen. No good news in this data. Nothing good to share. The dashboard is before you. Yesterday, we had 1,330 new cases out of over 16,500 tests. That gives a percent positive of 8%. And very sadly, we had another 9 deaths. As you look at that dashboard before you, the data is very concerning. There's no other way for me to say it. We are far past the peak that we had in the spring, and this wave certainly seems to be much more dangerous than what we experienced in the spring, which is why I decided to impose new restrictions over the past 6 weeks, and why I decided it was necessary to begin a 2-week pause that began on Monday of this week. Here's my message about this data. It is not at all surprising. I have been up here warning week after week for a month and a half that this is what we were in for, and therefore it's exactly what we expected. You shouldn't panic. You should take action. And that's exactly what I'm doing. That's what we're doing. There's no purpose in panicking. These data are not good. A lot of people, I feel the panic. People are saying they're scared. It's scary. It is scary. This is a scary data. But don't panic. Take action. The solution to changing the trend is totally within our control. We have the power to change the trend and save lives. It's following the rules, wearing our masks, heeding the pause, staying home, and cutting down our mobility, and just staying with the people we live with. It's really that simple. If we do that, this doesn't have to be scary. The numbers will turn around. So for those of you who doubt that we have a crisis, I hope this data is jarring for you and motivates you to take action. To those of you who are afraid, I would say, there's no point in being afraid. There's no point in panicking. We knew this was coming. We are preparing. We are prepared. We're working around the clock. More testing, more contact tracing, more field hospitals, more staffing. We're moving into action. And that's what I'm asking the people of Rhode Island to do. Act. Follow the rules. Bend the curve. Save lives. You can see percent positives increased from 6% to almost 7%. New hospitalizations increased from 326 to 384 cases. Total number of cases this week is slightly down from 629 to 563, but I think that's just a reflection of the fact that fewer people got tested over the holiday week. I don't take any solace in those numbers. We are trying to test as much as possible. We actually have a strategy of trying to find the positive cases, because now the solution is find positive cases, get people into isolation. Okay, so I'd like to begin today where I left off last week, which is to say thank you to the people of Rhode Island. In the week since I was last here, we had Thanksgiving. We had a long holiday weekend, and we have begun our statewide 2-week pause, which began Monday. And I would like to begin by acknowledging that none of this has been easy. Thanksgiving was hard. My kids said, "Mom, this is weird. It's unusual, it's unnatural. We miss our loved ones. Businesses are having a really hard time during the pause. We're reinventing ourselves, becoming resilient, getting our families through it. So I want to say thank you. I want to say thank you for getting through it together and bearing down and following the rules. There's some good news, though. which is that the early data suggests people are following the rules. So over the Thanksgiving week, our COVID enforcement unit did not receive a single credible phone call about large parties or gatherings. That's a good thing. We had been, a couple weeks ago, receiving phone calls. In about 700 business inspections over the past week, over 99% of restaurants and bars were observing the early closure requirement and had all customers seated. So thank you. Thank you for closing your bars. Thank you for closing early. 96% of businesses had proper social distancing. Nearly 100% of employees were correctly wearing masks at all times, and nearly 100% were complying strictly with capacity limits. Last week, a record high 55% of businesses received a perfect score for their inspections, and another 32% received a near perfect score. So that's fantastic. That tells me people are following the rules and hunkering down. And if that keeps up, that will work. We're also tracking, as I said I would, mobility data, traffic data. That's a really good way to tell, are people following the rules? And the traffic data shows a significant and steady decline beginning last Wednesday. Over the past week, traffic in Rhode Island was 10% less than the previous week. Now, it is true that we often see a decline over Thanksgiving, but this decline is double what we saw last year around Thanksgiving. For example, last year traffic around Thanksgiving was 5% less than the previous week. This year it's 10% less than the previous week. And the decrease in mobility has continued even more since the pause started on Monday. Over the last 7 days, we saw about 2 million vehicles, 1.9 million vehicles on the road in Rhode Island, which is not quite a 30% decrease from those 7 days last year. So why does this matter? Why am I in the business of tracking cars on the highway? Because we know mobility is a good indicator for cases. We've seen that in Rhode Island. We saw it in the spring. In the spring, we saw a drop in mobility about a week before cases started to decrease. By the way, you see that in every country and in every state around the country. Similarly, in October and November, we started to see significant upticks in mobility, and then a week or two later, we saw upticks in COVID cases. So this tells me people are following the rules, and you should too. Early data suggest Rhode Islanders are listening and pausing. They're staying home, working from home, not congregating, staying exclusively with the people they live with, wearing masks, and staying off the roads. The pause is working, people are following the rules, and you should too. So hopefully we continue to see a decline in mobility, which should lead to a decline in cases a couple of weeks from now. But we'll stay at it, and we will keep vigilant. At this point, I'm sure many of you want to know, am I going to lift the pause at the end of the 2-week period? I don't know. The answer is I don't know. I'm watching the data every single day. If it continues to look like this, mobility goes down, bars are closing, people are staying home, I would like to, and have intention to, at the end of the 2 weeks, slowly dial the economy back up. But today, I don't know. If we have to see if people keep following the rules. My biggest concern at the moment is overwhelming our hospital system. That's the risk. And so I'd like now to take a minute to go through where we are with hospitals. This week, we have opened both field hospitals. The field hospital in Cranston opened on Monday. The field hospital in Providence opened on Tuesday. As of last night, there were 7 patients at the Cranston site and about 20 patients expected over the coming days. There were 21 patients in Providence, with probably another 40 or 50 in the next coming days. I have been in touch with the heads of these hospitals, and they report to me that so far things are going very smoothly at these field hospitals. I want to thank Dr. Foreman and Dr. Sooner, both of whom were with me on the stage a few weeks ago. You guys are doing a great job. I'm sorry this is so tough, but thank you and your teams for this work. I will tell the people of Rhode Island that the quality of our field hospitals is about as good as it gets. I have seen some other field hospitals around the country, or I know of them, I see pictures of them, I know how they're set up. Some are in gymnasiums, some were more quickly put together. Our field hospitals they are not real hospitals, of course, they are in the convention center, but they are top-notch field hospitals with top-notch professionals. We took incredible care to establish them in that way, and I do want to give you some assurance in case you or your loved one winds up in a field hospital. Having said that, the facilities are only as good as the people who staff them. I want to be very clear about this and send a special message to people who are still not following the rules. Right now, we have capacity in these two field hospitals for about 900 extra beds. But we can't staff them. We do not have the staff. We cannot see our way right now to safely, comfortably staffing 900 beds, which is why it is absolutely vital that we don't get to a place where they all have to be used. So the next time you think it's fun or funny to have a party, break the rules, shave the rules, I ask you to think about what it would be like if your mom or your wife or your husband or your best friend wound up in a field hospital that was improperly staffed. Because that could happen to you or a loved one if we all don't follow the pause in these rules. I would also say healthcare workers are human beings. Every nurse and doctor, physical therapist, mental health professional, certified nurse assistant, these are mothers, fathers, sons, daughters. These people have been working for 9 months without a break under incredible stress. They are tired, they are exhausted, they are strained. So I would just say they deserve our support. Furthermore, although we are trying every day to figure out how to get more staff, the brutal reality is every country in America, every state in America is struggling with staffing. So the fact is cases are spiking everywhere, and so we don't have the same access to out-of-state physicians and nurses as we did in the spring. I know some of you are saying, well, Gov, there's 900 beds and they're not filled. This is true. But what good is a bed if you don't have adequate staffing? To that point, I am calling on everyone in Rhode Island who can help with the crisis to help out. This week, if you're a healthcare professional. So this week, the Department of Health again began issuing temporary licenses to retirees, visiting healthcare workers, and others who are completing their training programs. So if you're hearing me and if you're a retired healthcare worker of any kind or a healthcare worker who's currently underemployed, maybe have some time to spare, or unemployed or working in a non-healthcare setting, I'm asking you to suit up and help us out. If you're willing to work on the floors of our hospitals or our nursing homes or our field hospitals, we need you. Calling all healthcare workers in Rhode Island. You can learn more about immediately available positions at the website skillsforri.com. And hopefully that's up on your screen now, skillsforri.com. Or you could go directly to the lifespan.org website or the carenewengland.org website. to learn more about positions at the field hospitals in particular. I will say that in the past, when I have put out the call for substitute teachers or contact tracers, within a day or two, we've had hundreds, if not 1,000 people raise their hands. So that's what I'm asking you to do now. All available healthcare workers, please raise your hand to serve in any way that you can. Right now, we need you. I also want to thank our schools of nursing at URI, CCRI, and Rhode Island College. We have over 100 student nurse interns and over 125 graduate nurses lined up to start supporting our hospitals to help us. So thank you to URI, CCRI, and RIC. Good news, those three colleges have top-notch nursing programs, of which I am so proud, and I'm proud of the students who are stepping up to serve. Finally, if you have physical or mental health care experience, but you can't commit to a full-time job in one of our hospitals, or if you don't have health care experience, but you want to volunteer to assist in other ways, we need all kinds of help in these field hospitals, as you can imagine, meal delivery, there's many different ways we need help. Please visit riresponds.org, riresponds.org. We need volunteers. We need volunteers. We're really in the thick of it now. It's an all-hands-on-deck effort. And so if you have some time and you have some energy and you want to help out as a volunteer in any way across our whole of government response, please go to riresponds.org. And I can assure you, we'll put you to work right away, and you'll be doing good things to save lives in Rhode Island. Okay, I'd like to take a minute to talk about testing and also vaccines. As I have said earlier, one way to keep from overwhelming our hospitals is to identify as many cases as possible, as early as possible, and get people into isolation, which is why we are extremely focused on testing. Last week, I announced a series of changes that we're making to make testing quicker and more accessible. And I acknowledge that over the past month, it has been hard sometimes to get a test. Sometimes it takes too long, you're not sure where to go. To address that need, we have really pushed a lot more testing into the system, and I want to tell you where we are today. On Monday, a few days ago, we opened a brand new Binax Now asymptomatic testing site at the Dunkin' Donuts Center. What's Binax Now? Binax is the easy, do-it-yourself, 15-minute, painless COVID test. If you haven't done it, do it. Trust me, it's painless, it's easy. It's brand new, open Monday, we have capacity, sign up, go get one. We have capacity to run 500 tests per day at the Dunkin' Donuts Center. By Monday, next week, we'll be up to 2,500 tests a day. We've also added capacity at some of our newer testing sites, including McCoy Stadium, where we've increased our daily testing capacity by 1/3, and we've significantly ramped up our testing capacity for Rhode Islanders with symptoms. Last week, I said that I wanted to have capacity to run 3,000 daily tests for people with symptoms by the end of the pause. I want you to know we're going to exceed that. As of right now, we're at 2,500 daily symptomatic tests through the portal. So this is confusing. I understand that. There's been a lot of changes, and testing hasn't always been perfect. Here's the bottom line. There's more capacity than ever to get a test. Even if 2 weeks ago you were waiting for days or you couldn't figure it out, it's better now, and I'm asking you to give it a try. If you feel sick, call your doctor. call your healthcare professional. They'll take care of you, and they'll get you a test. But if you don't have a doctor and you feel sick, sign up yourself at our portal, portal.ri.gov. It's free, portal.ri.gov. Schedule it yourself. If you're not feeling sick, I still want you to get a test, especially if you work in a restaurant, hair salon, manufacturing operation. If you haven't been tested yet, if you did get together with family over the holiday, please, please, please go get tested. Sign up yourself. Go to the portal.ri.gov. It's simpler now. There's not a lot of requirements. They ask you 2 questions. Are you having symptoms? If yes, go here. If no, go there. And we have a lot of capacity. So I'm asking you, everybody, please go get tested if you haven't. And by the way, we're going to keep adding supply to the system to really keep it moving. Additionally, we're doing an awful lot of work in our high-density communities, most particularly Central Falls. And I want to thank the team who's doing that. We have expanded our testing capacity at Calcutt Middle School. We had a testing event for students at Ella Risk Elementary, and we are working to coordinate weekly asymptomatic testing at Bethel AME Church and Only Street Baptist Church in Providence. What we're trying to do in these highly dense communities, Providence, Central Falls, Pawtucket, is bring the testing to the community, in churches, in parking lots, in the community. So please go ahead and get tested. Okay, finally I want to end with the good news, which is vaccines. And there is a lot of good news. There is a lot of good news on the vaccine front. There are 2 companies, Pfizer and Moderna, that are on their way to FDA approval for a vaccine that is 95% effective. Now, for those of you who aren't vaccine experts, which includes me, that's a miraculously effective vaccine. Much, much more effective than the flu vaccine that we get every year. 95% effectiveness. These vaccines have both gone through 3 clinical trial phases with over 70,000 participants, 70,000 people in them. And before they'll be coming to Rhode Island, they still have to go and get FDA approval. The FDA is following the same rigorous standards for these vaccines as for everything else. They are not lowering the standards or changing the process. So if the FDA approves these vaccines, you can have as much confidence in them as any other medicine that you might take or vaccine that we would have. Additionally, on top of that, all of the data, all of the clinical trial data, all of the safety data, all of the efficacy data is public. And we have our own team of experts in Rhode Island combing through all of that data, as an extra pair of eyes, people on the ground, Rhode Islanders who care about Rhode Island, double, triple checking to make sure that this is safe before we administer a single dose. I also want you to know that while this is happening, while they're developing the vaccines, et cetera, we are taking action on the ground in Rhode Island, so we have a plan. I was asked a week ago how quickly, once we receive the vaccine, will we be getting it out to people in Rhode Island? Immediately is the answer. So we're already, and have been for weeks, working with hospitals to ensure they have the supplies and personnel to receive, store, handle, and administer the vaccine. We are already reaching out to doctors' offices, health clinics, pharmacies, and others to begin that same process. We're planning for every scenario and developing different distribution models based on the allocation that we receive. Also, the Pfizer and Moderna vaccines, they each have different requirements. That's a problem for us to worry about, not you to worry about. But I want you to know we're on it. We're on it. We know the details. We are on this every day, all day. They have different refrigeration requirements, different handling requirements, different travel requirements. We got it covered. We're working on it. We have a plan. Both of those vaccines, Pfizer and Moderna, which are going to be the ones available first, require 2 doses to be effective. Those doses have to be administered between 3 and 4 weeks apart. So you got to get one, and then we need you to come back within 3 to 4 weeks to get the second test, like a booster shot. So we are right now working day and night to develop technology systems and reminder systems to make sure people come back to get their second booster shot. And our data team is already working to build systems to keep the public informed about how much vaccine is in Rhode Island and how many doses will be administered. So I'm sharing this because, this is not a flip of the switch. I want to be crystal clear about this. What do I think? I think we will have some vaccine in Rhode Island by the middle of December. I do. I think, though, it'll be very limited initially and will ramp up over a period of months. And it's not going to be a flip the switch cure for everything that ails us. Our initial supplies will be limited. I'll give you my best estimates of what I expect based upon all the conversations we're having with Washington and our federal partners and the manufacturers. I think we could receive about 10,000 doses of the Pfizer vaccine in the next few weeks. I think we'll get about 19,000 doses of the Moderna vaccine probably a week after that. So by the end of the year, I think we'll have about 29,000 doses of vaccine in Rhode Island. Now, we're a state of 1 million people. 29,000 shots doesn't go a long way. So that's why we are prioritizing where those initial doses will be going. Those initial doses will be going to healthcare workers, first responders, high-risk individuals. If you want the details of exactly our plan, it's publicly available on the Department of Health's website, and we're consulting daily with the CDC and reviewing the ongoing guidance that they're putting out. We have a Rhode Island vaccine subcommittee, and they're overseeing the planning process for Rhode Island, and I'm going to continue to have more guidance in the days to come. But as I said, the vaccine is coming to us over the course of months, not weeks, and everybody needs 2 doses. So what's the bottom line? The bottom line is this. Help is definitely on the way. These vaccines are highly effective and highly safe, but they're going to trickle into Rhode Island over a number of months. They're not rushing into Rhode Island this month. And we're going to have to be very thoughtful about how we space out the administration. First to healthcare workers, nursing home workers, hospital workers, nursing home residents, etc. Bottom line is, for the rest of us, it's going to be many months before we're all vaccinated with 2 shots. So although the really strict regulations around the pause and closing businesses will be able to be eased up, we all need to settle in for months more of being careful, mask wearing, social distancing, and following the rules, which is why we are really investing so much to have incredibly robust testing, and contact tracing, because we're going to be at it for a while. Some people say that the 3 best reasons to live in Rhode Island are June, July, and August. I happen to think every month's nice, but it is true. June, July, and August are pretty great in Rhode Island. So here's what I would say. By the time we get to June, July, and August, we're going to have a fantastic summer. And as I said to business owners, I hope some of the regulations that we eased up on to let you take your businesses outside and do more business, I hope that stuff is here to stay so you can make up some of your business next year. But I finally feel confident in saying by late spring, early summer, we're going to be really kind of back on track and out and about here in Rhode Island. In the meantime, though, we all have to keep following the rules. Okay, I'm going to turn it over to Dr. Alexander Scott, and then I will come back to answer all of your questions. Before I give it over to the doctor, though, I do want to say that I realize rumors are rampant, and yesterday there was a lot of speculation about me being considered to become the Secretary of Health and Human Services, and I did want to address that honestly with you, so we can have this press conference together focused on COVID and the business of Rhode Island. I am not going to be President-elect Biden's nominee for HHS Secretary. My focus is right here in Rhode Island, as I have said. I'm working 24/7 to keep Rhode Islanders safe and keeping our economy moving, and I have nothing else to add on that topic.